So this is a summary of what types of things get secreted and reabsorbed across the tubule. This section right here is the proximal convoluted tubule, and it's the most important thing it really does is reabsorption. Almost 99% of these metabolites, glucose, amino acids, and other nutrients get reabsorbed right away in the proximal convoluted tubule. You also can have reabsorption of a lot of other things. 65% of the filtrate by volume gets reabsorbed immediately. There's some secretion that takes place there as well. Now, the loop of Henle is very complicated. That's our next segment. And it's because it has these different especially in the ascending limb, it has different permeabilities to water and sodium, and it's not so important for reabsorbing or secreting. Really, its main function is to create a concentration gradient, and it does that by reabsorbing water or sodium in different segments, and we're going to talk about how that works in a different video. So stay tuned for that. It's called countercurrent multiplication. The next segment, the DCT, is an important place for both secretion and reabsorption. Aldosterone is a hormone that affects this segment and can regulate the secretion of potassium and the reabsorption of sodium. Parathyroid hormone is a hormone that acts there and can cause the reabsorption of calcium. So important place and sensitive to hormones. And then finally, all of these nephrons empty into collecting ducts, and collecting ducts are where urine concentration is determined. So it's like the final step in cleaning out the closet. That's supposed to say determined. It's the final step in figuring out what your closet's actually going to contain. And the reabsorption of water is determined by antidiuretic hormone. Reabsorption of sodium is determined by aldosterone. And it's just very important here that all of these things get regulated. So the reabsorption and secretion that occurs to maintain blood pH is something that we're going to address in chapter 26, so the next chapter. So stay tuned for that.